I have to go to the bathroom frequently and occasionally have a little leakage of urine flow. Well, very common problem. As many as 15% of women will have that problem. It depends on the studies and the ages of people that you're studying, but it's not an uncommon problem. We call it urinary frequency, urgency, and incontinence. It's an overactive bladder. If you're going to the bathroom more than 8 times a day, we lump you in that group of people, especially if you have to run to the bathroom quickly. There are a lot of people that get urgency and as they're running to the bathroom have a little bit of leakage, or if they're out exercising, they have a little bit of leakage. What can people do about that? Well, number one, you need to be sure that you don't have a urinary tract infection. So a normal urinalysis will allow the doctor to know if you've got infection or not. After that, there's not a big workup that needs to be done, but there are some things that we can do. We always say, number one, stop smoking. Smoking will irritate this muscle at the bladder edge. It's called the detrusor muscle, and if that one becomes agitated, we get the urgency that we have to go. Lose weight is one thing we can do. Cut down on caffeine. So colas and iced tea and beverages with caffeine, most studies will show if you'll cut down on those, you'll have the less urinary incontinence. There are some exercises, they're called Kegel exercises, and that's where you clamp down on the bladder urethra area. And you clamp down for 10 seconds and you do groups of 15 of those. And you do it 3 times a day. Sometimes that will help you when you get the urgency that you can clamp down more effectively. When do you need a urologic workup? Well, if you go to the bathroom and you get up and you've got to void again immediately, you probably need to see your doctor and talk about a urology workup. There are medications that can help calm down the bladder. They frequently cause a dry mouth and sometimes some blurred vision. There are now some injections along the wall of the female urethra that can narrow the urethra and make it where it's not so uncomfortable for you. And so know that there are simple things that you can do if you have that problem. Work it out with your doctor and you'll find that you won't have that much a problem.